Hi, welcome to our channel of Ignouaudiobooks, Indira Gandhi National Open University, School of Continuing Education, Certificate Programs, Certificate in Nutrition and Child Care, CNCC, CNCC-1 Nutrition for the Community. Block-5, Nutrition-Related Disorders, Unit-19 Other Nutritional Problems. 19.1 Introduction. Units 17 and 18 of this block discussed some of the most important deficiency diseases which are not only widely prevalent but, more importantly, lead to complications and death as well. There are also other deficiencies which may occur in a large number of people. Some may cause irreversible changes in the body while others may not cause irreversible complications. Yet, these can interfere with the normal functions of the body. Some vitamin deficiencies are important examples. In this unit, we will discuss vitamin deficiencies like riboflavinosis, beriberi, and scurvy. You will also learn about fluorosis and latherism. The latter two diseases are not deficiency diseases. Latherism is caused by a toxin present in a foodstuff. On the other hand, fluorosis occurs because of excessive consumption of fluoride in water and foods. Objectives. After studying this unit, you will be able to describe vitamin deficiencies like riboflavinosis, beriberi, scurvy, rickets and pellagra. Discuss the major features of fluorosis and latherism caused by consumption of excessive amounts of a nutrient, fluoride, or a toxin and enumerate the measures taken to treat and prevent these disorders. 19.2 B-complex deficiencies. You have learnt that vitamins like thiamine, riboflavin, niacin, folic acid and Bi2 are the vitamins of the B-complex group. In this section, you will learn about what happens when there is a deficiency of these vitamins in the body. Let us begin with the riboflavinosis or riboflavin deficiency. 19.2.1 Riboflavinosis. Riboflavin deficiency. This is a nutritional deficiency occurring due to reduced intakes of riboflavin throughout the diet. Riboflavin deficiency is one of the most common among the B-complex deficiencies. How can we make out that a person is suffering from this deficiency? As in the case of other deficiency diseases you have studied, this disease is also associated with certain obvious clinical features. Clinical features. The major clinical features of riboflavinosis include A. Angular stomatitis. One of the clinical signs of riboflavinosis is angular stomatitis. The subjects develop cracks on both the sides, angles of upper and lower lips, of the mouth, Fig 19.1. This is a very common sign noticed among children, and as high as 30 to 35% of the children exhibit angular stomatitis. There is usually not much discomfort and because of this, children and adults ignore it. Figure 19.1 Angular stomatitis. Look at the screen for table content. B. Glossitis. This is particularly common among women, especially during pregnancy. The tongue becomes raw and red. There will be a burning sensation whenever foods which are hot and rich in spices are consumed. The tip of the tongue is affected first. In severe deficiency, the tongue may develop cracks as well. C. Cheiliosis. The lips develop cracks and become red. The subjects may also lose appetite. Causes. A. Riboflavinosis is due to dietary inadequacy of riboflavin. You already know that green leafy vegetables, milk, and organ meats are good sources of riboflavin. Whole grain cereals and pulses, nuts provide riboflavin in moderate amounts. As we have already discussed, in the families of poor rural communities, diets contain negligible amounts of pulses and milk. Meat is consumed, but very rarely. As a result, riboflavin deficiency is very common in our country. In fact, the requirements of riboflavin are directly associated with the amount of food energy consumed. The higher the amount of food energy consumed, the higher will be the requirements of riboflavin. Turn back to Unit 6 of Block 2 for more information. You have learnt that Indian diets are mainly cereal-based. Cereals are not good sources of riboflavin. Therefore, our diets tend to be deficient in riboflavin. Treatment: patients suffering from a riboflavinosis should be given 1 tablet of B-complex daily for about 1 week to 10 days. Prevention: milk is a good source of riboflavin. However, poorer communities cannot afford milk in view of its high cost. We have to make sure that the communities include foods rich in riboflavin like green leafy vegetables, whole cereals and pulses and cheaper nuts in their everyday diet to prevent a riboflavinosis. Check your progress exercise. 1. 1. List the clinical features of a riboflavinosis. 2. What dietary advice would you give to prevent a riboflavinosis? Answer in 3. 3. Fill in the blanks. A. Milk is a blank source of riboflavin. B. Higher the consumption of energy in food, blank will be the requirement of riboflavin. C. The changes noticed in the tongue due to a riboflavinosis are referred to as blank. 19.2.2 Pellagra, niacin deficiency. This is a nutritional disorder due to the deficiency of niacin, one of the B-complex groups of vitamins in the diet. Though it is not as common as a riboflavinosis, pellagra is more frequently seen in the Telangana region of Andhra Pradesh and adjoining parts of Maharashtra and Karnataka. Clinical features: pellagra is characterized by typical skin changes, dermatosis, diarrhea and mental changes. Dermatosis means changes in the skin. The patients suffering from pellagra exhibit typical skin changes. These changes are symmetrical and are evident only on the parts of the body exposed to the sun like the forearms and legs, the face and the exposed parts of the neck. The skin becomes dry and scaly. Figure -19.2. Figure 19.2 Pellagra. Look at the screen for table content. Diarrhea, i.e. loose motions, is also present. In some cases, of course, this may be absent. Patients of pellagra have slight mental changes. These include irritability, forgetfulness and a loss of orientation. We are using the word orientation to mean the sense of being able to relate to time, place and events. There may be headaches and sleeplessness, tremors of the hands and legs and mental depression. Mental changes may be very noticeable when the patient suffers from severe niacin deficiency. It is estimated that a number of patients with pellagra go to mental hospitals for treatment because of these mental changes. Usually, glossitis is also seen in individuals with pellagra. Causes: pellagra has been known to be common in countries where maize is a staple such as Mexico. The niacin in maize is in a bound form and is not available to the body. Hence, people who consume maize as the staple cereal have greater chances of developing pellagra. In India, however, the disease is common in areas where war is the staple cereal like in the Telangana region of Andhra Pradesh and the adjoining Maharashtra and Karnataka. This is because of the presence of excessive amounts of the amino acid leucine in jowar, leading to an imbalance between leucine and isoleucine. You may wonder as to what is an imbalance between amino acids. The human body, for normal functioning, has to maintain a balance between various amino acids. When this balance is affected and one amino acid is more than the other, it is known as an imbalance. You have already learned that the body needs 8 essential amino acids, leucine and isoleucine being 2 of these. Please refer to Unit 3 of Block 1. Treatment: nicotinamide is a drug of choice. It is a compound of which niacin is a part. Niacin as such is not given because when taken in large dose, it produces some unpleasant effects like the face and body becoming hot and red, nausea and vomiting. Nicotinamide brings drama. Relief to patients suffering from pellagra. Generally, a dose of 300 mg per day is given. Along with it, B-complex tablets are also given. Prevention: you know that pellagra is a preventable disease. The important aspect of prevention is encouraging communities to consume mixed cereal diets so that adequate niacin is available in the diet. The communities should be educated to consume diets based not only on jowar but also rice or wheat. In addition, inclusion of pulses, even in small amounts, is useful in the prevention of pellagra. Nuts, oilseeds and organ meats are also good sources. You learnt in Unit 4, Block 2 that milk contains high amounts of tryptophan which the body converts into niacin. 19.2.3 Beriberi, thiamine deficiency. Beriberi is a nutritional deficiency disease caused by the deficiency of the vitamin thiamine in the diet. The disease is rare in our country. Please refer to Unit 4 of Block 2 for more information on thiamine. Clinical features. Beriberi is a disease of slow origin. Generally, the individual starts with experiencing loss of appetite, weakness and heaviness in the legs. The person also becomes tired easily. The patient complains of the feeling of pins and needles and numbness in the legs. There may be loss of sensation, i.e., loss of the feeling of touch over the legs. The disease occurs in two forms. It manifests itself either as wet beriberi or dry beriberi. Wet beriberi is characterized by the accumulation of fluid in the body. This can ultimately lead to heart failure. The patient may complain of palpitation, forcible and rapid heartbeats felt by the patient, and sometimes of chest pain. There may also be pain in the leg muscles on application of pressure. In the case of dry beriberi, the patient will feel a weakness in the legs progressively making the patient completely bedridden. Causes. The disease is primarily due to the inadequacy of thiamine in the diet. The disease is very common in communities consuming rice which is highly polished. This is due to the fact that during polishing the thin outer layer of rice, which contains thiamine, is removed. Do you remember Highlight 1 in Block 27? Losses during refining were discussed in detail there. In parts of South India, beriberi was commonly seen when highly polished rice was being consumed. It is rare in our country nowadays, perhaps because the diets are not based on highly polished rice. Also, rice is rarely the only staple being consumed. Other cereals are also eaten in varying amounts. Even in South India, the communities consume diets consisting of wheat, millets and pulses, though in small amounts. These are good sources of thiamine. In the communities subsisting on parboiled rice, beriberi is not seen. Can you explain why? Treatment. In the case of both wet and dry beriberi, thiamine should be given by injection into the muscle at least for 3 days. The patient should be advised of complete rest. Thereafter, thiamine tablets can be given 3 times a day. Prevention. The best way to prevent beriberi is to consume rice which is not highly polished. In fact, hand-pounded rice is the best. We can also take steps to reduce polishing of rice while milling. This will help to prevent loss of thiamine. There are a number of modern rice mills where we can produce rice with less polishing. An increase in consumption of pulses and other thiamine-containing foods prevent beriberi. The richest dietary sources of thiamine are yeast and bran, outer layer, of wheat and millets as we mentioned earlier in Unit 4, Block 2. Check your progress exercise. 2. List the clinical features of beriberi. You are listening to this audiobook on Audio Learn Ignou 19.3, Vitamin D Deficiency. Rickets is a disease of growing children in which the bones become softened and deformed due to the deficiency of vitamin D. Osteomalacia is the adult form of vitamin D deficiency. In the subsequent discussion, we will explore the major features of these disorders as well as their treatment and prevention. We begin with the causes. Causes. You have already learnt that vitamin D is one of the fat-soluble vitamins. In Unit 4 of Block 2 you discovered the amazing fact that vitamin D is synthesized, manufactured, in the SKJ and it exposure to sunlight. We have plenty of sunlight in our country and hence the disease is not as common. However, the disease is more frequently seen when there is not enough exposure to sunlight. In the subsequent discussion on clinical features, treatment and prevention we will have to talk about rickets and osteomalacia separately. Let us begin with rickets. Rickets. The young child in certain parts of our country frequently becomes a victim of rickets. Rickets is characterized by a range of specific clinical features, as you will see in the following discussion. Clinical features. In the initial stages of the disease, children become restless. The muscle lose their firmness and become flabby. When the abdominal muscles lose their firmness, the abdomen gets distended. You know that a normal baby's teeth erupt at a particular age. The baby sits and crawls at a particular age. These are known as developmental milestones. In the case of rickets, there is a delay in these milestones. For example, teeth erupt late in children with rickets. There is also considerable delay in the age at which the child can sit and crawl. The child is too weak and is unable to walk in some cases. The most important changes caused by this disorder are seen in the bones. The growing ends, epiphyses, of the long bones, like those of the forearm, get extended and widened. For example, there will be a swelling of the forearm bones at the wrist. There may also be swelling at the ends of the ribs, which gives an appearance of beating of ribs or rachitic rosary. In other words, the enlargements on the ribs on the chest of the child give an appearance of a rosary, chain of beads. In normal children, the anterior fontanelle, an opening between the skull bones, closes by about 18 months of age. In rickets, the closure of the anterior fontanelle is delayed. In view of the softening of the bones, the children develop what is known as craniotabes on the skull. As a result, the skull bones, instead of being hard, give a feeling of yielding when pressure is applied on them. The child ultimately develops various deformities of the bones. Deformities of the eye chest with the breastbone becoming prominent are common. This protruding of the breastbone is usually known as pigeon chest. The typical deformities seen in children who have recovered from rickets are due to the child's weight bearing down on the legs before complete recovery takes place. At this time, the bones are still soft and cannot stand the weight of the child. As a result, the children may have bow legs, bent like a bow, or knock knees, when both the knees will be touching each other, unlike in normal children. Some children may have bossing, prominence or jutting out, of the frontal, front, and parietal, side, bones of the skull. Deformities of the backbone also may develop if the disease continues beyond the age of 2 years. Figure 19.3. Figure 19.3 Rickets. Look at the screen for table content. Treatment. Vitamin D and adequate intake of calcium are important requirements for treating rickets. Several preparations of vitamin D are available. These also provide vitamin A generally. Cure results with daily treatment of vitamin D for about 4 weeks. The treatment should be supplemented with calcium. Prevention. Adequate exposure to sunlight is the most important factor in protecting the child from rickets. Dietary sources are few and the vitamin is found chiefly in fish liver oils and egg yolk. Milk is not a good source of vitamin. Inclusion of these foodstuffs in daily diets prevents rickets. Supplementation with vitamin D is generally not required in India. However, where required, particularly among families confined to the indoors, cod liver oil is of known value in the prevention of the disease. Osteomalacia. As you have already learned, osteomalacia is the adult form of rickets. We come across osteomalacia commonly in women of reproductive age, 15 to 45 years of age. This is more common among women who have had many pregnancies. The disease is frequently seen among women belonging to low socioeconomic groups depending on poor diets and who are confined to the house. In India, osteomalacia is not yet common. Osteomalacia can also be caused by some digestive disorders which may interfere with absorption of vitamin D. Clinical features. Pain in ribs, hip bone, lower back and legs is the most common complaint. There is muscular weakness and the woman usually finds it difficult to climb stairs. There will be pain on the application of pressure on the bones like the hip bone. Sometimes there may be fractures of the bones. Deformities of the backbone are common. Treatment. Daily vitamin D is the drug of choice. Very rarely, Once a week or fortnightly injection of vitamin D into the muscles may be necessary. Supplements of calcium should be given as well. Generally, symptoms subside within 4 to 8 weeks. Prevention. Free access to sunlight is the best way to prevent osteomalacia. Once the deformities occur, we cannot correct them. Vitamin D supplements in pregnant women can be undertaken in susceptible cases, like in the case of people who are generally confined indoors and in women who AA for multiple pregnancies. Check your progress exercise. 3.1. Fill in the blanks. A. Rickets and osteomalacia are due to the deficiency of blank in children and blank respectively. B. The changes noticed on the ribs due to rickets appear like a blank. C. Exposure to blank is the best way of meeting vitamin D needs. D. In rickets, blank ends of the bones get extended and widened. E. For the prevention of rickets, blank oil is of known value. 2. What is required for the synthesis of vitamin D by the body and where is it synthesized? 19.4. Vitamin C deficiency. Scurvy. Scurvy is a nutritional disorder due to inadequate intake of vitamin C. It is observed when people subsist for prolonged periods on diets devoid of fresh fruits and vegetables. It is not a commonly observed nutritional deficiency in India. Clinical features. The most important clinical sign of scurvy is spongy, bleeding gums. The gums are swollen, particularly in the region between the teeth. They bleed even on slight touch. Infection of gums is also usually present. Tiny spots may be seen on the skin above the knees and on the lower parts of the thighs due to bleeding. There may also be anemia due to associated iron or folic acid deficiency. Untreated, the deficiency can lead to death due to internal bleeding. Causes. Scurvy is due to consumption of diets which do not contain fresh fruits and vegetables for very long periods. This leads to deficiency of vitamin C or ascorbic acid. You know that vitamin C is destroyed by heat, i.e. by cooking. Hence, even if the diet may appear to contain adequate amounts of vitamin C, it may still cause scurvy due to destruction of vitamin C during cooking. Treatment. Vitamin C tablets should be given to the patients. Vitamin C by mouth 1 is most often adequate. In acute cases, vitamin C injections into the veins will be necessary. It should be followed by administration of vitamin C by mouth continuously. Prevention. Amla, guava, citrus fruits, lime, orange are rich sources of vitamin C. Amla is, in fact, the richest source of vitamin C. Similarly, sprouted, germinated pulses like whole Bengal gram are good sources of vitamin C. Communities should be educated to include one of these foods in the diet regularly. 19.5. Fluorosis. Fluorosis is a disease caused by consumption of excessive amounts of the mineral fluorine for long periods. Fluorine is essential for the development and maintenance of normal bones and teeth. However, if it is consumed in excessive amounts, it leads to fluorosis. Research has also indicated that low fluoride intake can lead to dental caries, cavities in teeth. Fluorosis is an important health problem in some districts in the states of Andhra Pradesh, Punjab, Karnataka, Tamil Nadu, and Rajasthan. Causes. The main source of fluoride for us in India is drinking water. Drinking water should contain less than 1 mg per liter of fluoride. In areas where fluorosis is common, the fluoride content of water is as high as 3 to 12 mg/liter. In these areas, the population depends on wells for their drinking water. Normally, fluoride content in flowing rivers is not high. In our country, due to the hot climate, we generally consume more water and thus take in higher amounts of fluoride. The foods do not, however, contribute much of fluoride. The daily diets, however, may provide about 0.25 mg of fluorine. Only foods such as sea fish, tea and cheese are rich in fluorine. Clinical features. Fluorosis is manifested as changes in the teeth, dental fluorosis, and in bones, skeletal fluorosis. In other words, the clinical manifestations will be seen in teeth and bones. Dental fluorosis. In children living in areas where fluorosis is common, the disease affects only the teeth. The teeth lose their shine and chalky, white patches appear on them. This is known as mottling of teeth. Mottling is considered as an early sign of fluorosis. Later, these white patches become yellowish. In severe cases of fluorosis, the hard, glistening substance covering the crown of the teeth, enamel, gets eroded, ultimately leading to depressions on the teeth. Figure 19.4. This is known as pitting. Mottled enamel is best seen on the upper cutting teeth known as incisors. You do not see mottling in the teeth of children below the age of 5 years. Skeletal fluorosis. In older individuals, fluorosis leads to changes in the bones because of the consumption of excess of fluoride for prolonged periods. Initially, the individual will have pain in the neck and stiffness of the back. This progressively leads to difficulty in the movement of the neck and back. We can see the changes in bones only when X-rays are taken in early cases of skeletal fluorosis. In severe skeletal fluorosis, the patient will be so incapacitated as to be completely bedridden. Recently, in some areas of Andhra Pradesh and Tamil Nadu, a new form of fluorosis has been recognized. In such a case, we see changes in legs which look like a severe form of knock knees. This new form of fluorosis seen in Andhra Pradesh and Tamil Nadu is called Ignouaudiobooks. What causes Ignouaudiobooks? We are still not sure, but trace element imbalances appear to be the reason, along with high intakes of fluoride. Figure 19.4. Dental fluorosis. Look at the screen for table content. Prevention. Fluorosis can be prevented but cannot be cured. The best method to prevent fluorosis is to consume water which has less than 1 mg per liter of fluoride. In other words, steps should be taken to supply drinking water with safe levels of fluoride to the communities to prevent fluorosis. Where this is not possible, defluoridation, removal of excess fluorine, of water is the only alternative. This can be done at the household level. A simple method is to first add lime powder to the pot of drinking water. Then alum is added. It is stirred for about 10 minutes. The water is then decanted off and stored in clean vessels. Such water will have fluoride in safer levels. Large-scale defluoridation using costly modern instruments is not possible. Intensive education of the community is necessary to encourage domestic defluoridation. Check your progress exercise. 4. 1. Fill in the blanks. A. Fluorosis is due to blank consumption of blank. B. Normal drinking water should contain less than blank of fluoride. C. Fluoride in inadequate amounts in the diet can cause blank of teeth. D. Changes in bones due to excessive consumption of fluoride is known as blank fluorosis. 2. The following is a list of symptoms of nutritional deficiency disorders. Tick the ones specific to scurvy, mental changes, glossitis, cracks on lips, spongy, bleeding gums, rashes on skin, pale conjunctiva, spoon-shaped nails, tiny spots below skin, bleeding on touch. 3. How can you remove excess fluoride from water at the domestic level? You are listening to this audiobook on Audio Learn Ignou. 19.6. Letharism. Letharism is a disease of the nervous system caused by the consumption of a pulse, kesari dull, for prolonged periods. It is a serious public health problem in some districts in the states of Madhya Pradesh, Bihar and Uttar Pradesh, where kesari dull is widely grown. Causes. Kesari dull, Letharis sativus, contains a toxin which affects the nervous system, neurotoxin. The toxin causes damage to the nervous system. The disease is common among landless agricultural laborers in Madhya Pradesh, Bihar, and Uttar Pradesh. Particularly during drought seasons, the agricultural laborers depend solely on kesari dull. In fact, kesari dull is a hardy crop which can survive even in severe droughts when much of the wheat crop is damaged. The agricultural laborers in these areas receive the dull from the landlords as wages. They prepare rotis using the dull and consume the same. Clinical features. This is a disease of the nervous system, as we have already mentioned. In the initial stages, when the individual is subjected to physical stress, exercise, he exhibits a gait, walking style, which looks awkward. At this stage, if the dull is withdrawn, further progress of the disease can be controlled. The progress of the established disease is typical and one can observe 4 clear stages. In the first stage, the patient will walk with jerky movements without the aid of a stick. This is called the no-stick stage. As the disease progresses, the patient can walk only with the support of a stick. This is called the one-stick stage. During this stage, the patient walks on his toes with the support of a stick with the knees slightly bent. While walking, there is the crossing of legs one over the other. When the symptoms are more severe, the patient can walk only with the support of 2 sticks. Two-stick stage. The gait is slow and clumsy. There is a crossing gait, i.e. the legs cross one over the other while walking and the knees are markedly bent. The patient gets tired easily on walking even short distances. Ultimately, the knees are bent completely and the patient can only crawl. This is called the crawling stage. Young agricultural laborers are affected by the disease. Ultimately, these youths end up as beggars due to this disabling paralysis. Prevention. There is no specific treatment for the disease. Appropriate steps should be taken to prevent the disease. The banning of the crop is the surest way of preventing the disease. In fact, under the Prevention of Food Adulteration Act of the Government of India, Kesari dal is banned in all forms, i.e. whole dal and flour. Unfortunately, it is not being effectively operated in states like Madhya Pradesh and Bihar, where the problem of latharism is common. There are other methods of prevention. If only we can remove the toxin in the dal, we can still use the dal. Highlight 3. Figure 19.5 Stages of latharism. Look at the screen for table content. Highlight 3. Removing the toxin from Kesari dal. Parboiling of Kesari dal is one of the simple methods to remove the toxin. This method can be organized on a large commercial scale. At the domestic level, the toxin in Kesari dal can be removed by steeping. In this method, water is first boiled and the container of water is removed from the fire. The dal is then soaked in this boiling water for about 1 hour. The water is drained off and the dal is then sun-dried. About 90 to 95% of the toxin in the dal is leached off or dissolved in the water. This practice can be encouraged through education of community members. Look at the screen for table content. Agricultural scientists are now trying to identify types of Kesari dal with low levels of the toxin or no toxin at all. Such varieties would help to solve this problem because of the fact that Kesari dal is a sturdy crop with a good yield. Without the toxin, it is a valuable food. In the long run, the food habits of the communities require to be changed so that they do not solely depend on Kesari dal. Large-scale nutrition education efforts are required for the purpose. Check your progress exercise. 5. 1. Fill in the blanks. A. Latharism is caused by a blank present in a blank. B. The toxin present in Kesari dal affects the blank system. C. The surest way of prevention of latharism in the country is blank of the crop. D. At the domestic level, the toxin in Kesari dal can be removed by blank method. 2. The following alternatives. A. E. Describe symptoms typical of a particular nutritional problem. Identify the problem in each case. A. Cracks on angles of lips, raw and red tongue, cracks on lips, sensitivity of eyes to light. B. Gum problem, internal bleeding on touch, associated anemia. C. Symmetrical skin rahes on exposed body parts, loose motions, loss of orientation. D. Tiredness, palpitation, loss of sensation, pain in leg muscles, accumulation of fluid. E. Delayed developmental milestones in young children, beading of ribs, delayed closure of anterior fontanelle, bow legs. Problem 19.7. Let us sum up. In this unit you have learnt about some more vitamin deficiencies and problems arising due to excess intake of fluorine and kesari dal. You have read that riboflavinosis is due to the dietary deficiency of riboflavin, one of the B complex vitamins. The main clinical features are angular stomatitis and glossitis. It can be prevented by addition to the daily diets of pulses/nuts/milk/green leafy vegetables. Pellagra is due to the deficiency of niacin, one of the B complex group of vitamins. It is characterized by skin changes, mental changes, diarrhea. It is common in populations solely subsisting on maize and jowar. The disease can be prevented by consuming mixed cereal diets. Beriberi is due to the deficiency of thiamine, one of the B complex vitamins. It was common in populations consuming highly polished rice. The disease is rare nowadays. Wet beriberi manifests with swelling of legs and face. Dry beriberi presents as weakness in limbs. There may be palpitation, rapid heartbeats, chest pain, feeling of pins and needles and numbness. The disease can be prevented by consuming hand-pounded rice or rice which is not highly polished. Rickets is due to vitamin D deficiency in children and osteomalacia is its adult counterpart. Vitamin D is synthesized in the skin on exposure to the ultraviolet rays of the sun. It is common in India in individuals who are not exposed to the sun and remain confined indoors. The growing ends of long bones become widen and the muscles become weak in rickets. Developmental milestones like the age at sitting and crawling are delayed in the disease. When the disease heals, how legs, knock knees, pigeon chest, frontal bossing etc. may develop. Spinal deformities are also common. Vitamin D is given for treatment and prevention is by exposure to the sun and inclusion of good food sources if possible. The deficiency of vitamin C in the diet causes scurvy. In India it is relatively uncommon. It is characterized by spongy bleeding gums where gums start bleeding even on slight touch. Tiny bleeding spots also may be seen around the knees and lower thighs. It can be prevented by the consumption of diets which contain foods rich in vitamin C such as citrus fruits, orange, lime, guava, amla and sprouted pulses like chana or Bengal gram. Fluorosis is a disease caused by excessive consumption of fluoride. It is an important health problem in some districts of Andhra Pradesh, Karnataka, Punjab, Rajasthan, and Tamil Nadu. In children, it manifests as dental fluorosis which is characterized by mottling and pitting of teeth. In the case of older individuals, skeletal fluorosis develops. It is characterized by changes in the bones which can be seen only in X-rays. The patient develops pain and stiffness of the neck and back. Defluoridation of water can be done at the domestic level to remove excess fluorine. This would help to prevent fluorosis. Laterism is a disease of the nervous system seen in landless laborers in the states of Madhya Pradesh, Bihar and Uttar Pradesh due to consumption of kesari dal for prolonged periods. It leads to paralysis of the lower extremities affecting mainly youth who end up as beggars. The toxin in the dal can be removed by parboiling of the dal on a large scale or steeping it in hot water. Education of the communities in the areas to avoid dependence on the dal or banning of the crop can help in the control of the disease. 19.8 Glossary. Pins and needles, a feeling of pricking by sharp pins or needles. Enamel, the hard, glistening substance covering the crown of a tooth, i.e. its top part. Muscle tone, firmness of muscle. Incisors, cutting teeth, 4 in number in each jaw. Anterior fontanelle, a diamond-shaped opening on the scalp between frontal and parietal skull bones. Microgram, UG, 1/1000th of a milligram. Dental fluorosis, changes in the teeth due to fluorosis. Mottling of teeth, a sign of dental fluorosis in which chalky white or yellowish patches appear on the teeth. Bow legs, a deformity when legs are bent like a bow. Knock knees, a deformity in which both the knees touch each other. Alum, a chemical compound containing a double sulfate of aluminium. It helps in settling of physical impurities of water. Gait, walking style. Prevention of Food Adulteration Act, an act formulated by the Government of India to prevent adulteration of foods with harmful substances. Frontal bone, the single skull bone forming the forehead. Parietal bones, the bones, 2 in number, forming part of the upper and each side of skull. Thank you. We will see you in the next video.